Dear students, today's our topic is acute appendicitis. How to define it? Inflammation of vermiform appendix is called acute appendicitis. What is appendix? Finger-like projection as a vestigial organ attached at posterior medial part of a cecum 2 to 5 cm below iliocecal junction. Size in length 7.5 to 10 cm, diameter 0.2 cm. Positions commonest retrocecal 74%, pelvic 21%, rear paracecal, subcecal, pre or post ileal. Histology mucosa, submucosa, muscularis and serosa. Blood supply, arterial supply by appendicular artery which is supplied by branch of iliocecal artery which is supplied by superior mesenteric artery. Venous drainage of appendix by appendicular vein which is supplied by posterior cecal vein which is supplied by superior mesenteric vein, and superior mesenteric vein is supplied by portal vein. Lymph node drainage by iliocecal lymph nodes. Types of appendicitis. There are two types of appendicitis. Number 1, obstructive 90%, and number 2, non-obstructive 10%. 10% non-obstructive appendicitis is due to viral infections, measles. Obstructive acute appendicitis because of obstruction of appendicular lumen due to fecalith matter, worms, lymphoid hyperplasia. Risk factors include peak age 10 to 20 years, female ratio more than male, rare in children less than 4 years and elderly more than 80 years, diet rich in meats, diet lacking of fibers, cellulose. Pathogenesis. Obstruction of the lumen of appendix cause stasis of intestinal contents. जैसे कि बहती हुई चीज़ पाक होती है, अगर एक जगह पे इंटेस्टिनल कंटेंट्स की स्टेसिस होगी तो वहाँ पे मसला होगा. Stasis of intestinal contents cause overgrowth and proliferation of normal intestinal flora because of gram-negative rods which include Pseudomonas, Proteus, E. coli, Klebsiella, Bacteroides, which cause invasion of the appendicular wall, which cause inflammation. Clinical features include 10 to 20 years age, female ratio more than male, pain site initially umbilical 1 to 3 hours, then shift to right iliac fossa. Nature sharp, agonizing. Severity increase with time, aggravating on movement and coughing, relieving by lying still and by analgesics. GI abscess, nausea, vomiting, anorexia, constipation usually occur. Variation in presentation cause diarrhea when inflamed appendix touches rectum, cause burning micturition when inflamed appendix touches ureter. Infants less than 1 year with persistent diarrhea and vomiting. Child with abdominal pain and do not eating his or her favorite food. Octogenarian 80 years elderly patient shocked and confused with abdominal pain. On examination, General physical examination shows pulse, increased tachycardia, increased temperature, white coated tongue, sign of repeated vomiting, foul smell, fetor oris. On abdomen examination, inspection, pointing sign, दर्द की तरफ इशारा करने वाली जगह is McDermott point, cuff sign positive, increased pain on cuff, palpation, tenderness in right iliac fossa positive, gardening positive, when inflamed appendix touches parietal peritoneum, contraction of abdominal muscles, rebound tenderness, after deep palpation, release pressure, suddenly cause pain, worsening sign on pressing left iliac fossa, cause pain in right iliac fossa, obturator sign, flexion and internal rotation at hip joint increases pain, Schwarz sign, pain usually lying with flexed hip joint, hyperextension at hip joint increase pain because appendix lies on Schwarz muscle, percussion non-significant, auscultation decrease bowel sounds, per rectal examination in case of pelvic appendicitis painful, it may be the only clinical sign with pelvic appendicitis. CBC shows increased TLC. If female beta HCG negative, then consider appendicitis. Urine examination shows UTI. Urine examination to rule out UTI. Ultrasound abdomen helpful, can pick up detailed diagnosis, mainly confirmed by Alvado scoring system. It includes number 1 migration of pain 1 point, nausea vomiting 1 point, anorexia 1 point, tenderness in right iliac fossa 2 point, temperature 1 point, TLC raised 2 points and neutrophils 1 point. Interpretation, less than 4 score unlikely, more than 4 to 7 under observation, more than 7 likely urgent appendectomy. Surest investigation CT MRI abdomen. Treatment, pre-operative management, NPA nil per oral, IV fluids, analgesics, NSAIDs, injection pethidine, antiemetics, injection gravinate, etc., IV antibiotics, injection ceftriaxone, and injection metronidazole. Treatment of choice, urgent appendectomy. Complications include number 1 perforation, number 2 peritonitis, number 3 appendicular mass, number 4 appendicular abscess, and number 5 appendicular fistula. That's it about appendicitis. ये जो पॉइंट्स हमने अपेंडिसाइटिस में कवर किए हैं एग्ज़ाम पॉइंट ऑफ व्यू से इंतहाई अहम है। आप कोई भी एग्ज़ाम दे रहे हैं, आप NRE का एग्ज़ाम दे रहे हैं या प्लैब का एग्ज़ाम दे रहे हैं या दुबई का एग्ज़ाम दे रहे हैं, तो इसमें आपकी हेल्प हो सकती है। शुक्रिया।